Hi there, I'm Shari Einhorn. Thanks so much for joining us. You're watching Your Health Matters on Sun 20 TV. We have a great show for you today. We are talking with some fantastic guests. Joining me first is Dr. Eric Lella, family medicine physician at the Edie Windsor Healthcare Center in Hampton Bays. Now, my understanding is the healthcare center provides specialized care for folks in the LGBTQ plus community, along with HIV and AIDS care. Is that accurate?
Correct.
Okay. Tell me a little bit about the center and why the specialized care.
So our clinic existed for a little over the past 25 years, is primarily just an HIV care, HIV prevention clinic. And then in May of 2021, we assumed a new name under the Edie Windsor Healthcare Center with the goal of moving our clinic to Hampton Bays to expand, to include family medicine, so primary care, that's where I got brought in. And we're expanding our mental health services. I'm also board certified in neuromusculoskeletal medicine, so I provide osteopathic manipulative treatment services there as well.
Now, we were talking before we came on the air that the healthcare center, the move was supposed to happen a little bit sooner, but like everything else, COVID sort of halted that or delayed it.
Yeah, we had a little bit of a delay. Construction was supposed to start in April of 2020, so it didn't. And we were finally able to make the move and open last May. So we've been open a little over a year now. Our primary care panel of patients has been steadily growing. We are in the process of expanding our mental health services, as we know is probably one of the biggest needs, and based on some of our community outreach has been identified as certainly one of the biggest requests as needs for healthcare when we've surveyed our LGBTQ plus population in Suffolk County.
Okay, so I want to go through a couple of statistics. So New York State Health Department just released a report on health disparities in the LGBTQ plus community. Big report, lots of numbers came out of that. But to give people a sense as to what we're talking about, in New York, about 1 million adults, or 8%, identify as LGBTQ plus, and about 0.5% identify as transgender or gender nonconforming. Those are adults. The percentages are higher in 18 to 24-year-olds. You mentioned mental health. Other challenges for that community include limited access to health care, no health insurance, no health care provider. Can you talk a little bit about that?
Yeah, so you mentioned mental health services amongst the percentages of the population in New York State that identifies as LGBTQ plus. We see higher incidences of mental health illnesses. We also see higher instances in this community of other medical problems, other mental health illnesses, addiction illnesses, and just an array of different substance abuse, obesity, tobacco use, a number of things. So the LGBTQ plus population, and this is something that we've seen kind of across the United States, and I'm sure is true elsewhere, is that there's not as many people who are established with a primary care physician. A lot of that is probably because of stigma. Over the years of going to different doctors' offices, not being addressed properly, perhaps if they're gender nonconforming or transgender, certainly there can be very unwelcome environments, and just not being asked the correct questions by your doctor. I can tell you that I have a lot of patients who are very nervous when they come in. There's a question that they have about their health, and some of them will feel if they've gotten out the door and the doctor didn't bring it up, maybe it's okay. Then I didn't have to bring it up, and we're going to ignore it. So we see a lot of lack of care building up over years, and that leads to these specific needs. And so having a center such as ours, where we have a welcoming environment, staff who is specially trained to address all of our patients wherever they lie in the demographic, the welcoming community, where the stigma is kind of removed, it allows our patients to come in and feel like they can actually discuss everything that's going on or that they have concerns about. Certainly mentioning different risk factors that, to be honest, if you go to, certainly going back, other primary care physicians or other specialists, they're just not asking the correct questions regarding risk factors that are unique to people in the LGBTQ plus population.
I want to ask you more about that, but before we get too far past it, I want to ask you, so how do you provide a welcoming environment, especially if you're talking about folks who may have had some really negative experiences that I would imagine is really hard to overcome?
Yeah, so out the bat, our waiting room is, we have a little bit of LGBTQ plus flair in there, so it's nice and warm and inviting. And our front desk staff, I really have to say I'm ridiculously lucky with the staff that I work with at the Edie Windsor Healthcare Center. Everybody's just so phenomenal, so nice, and just so attentive to our patients. Not a day goes by where I don't have one or more patients telling me how nice my front desk staff is, or my medical assistants are, or a social worker, or other specialists working there. So all of our staff has done LGBTQ plus healthcare, basically training and education on how to address patients in the community.
It really starts from the first greeting, right?
Yeah. So asking a patient right out the bat, what are your pronouns, your preferred pronouns? Asking a patient if they go by a name that's different than the name on their legal document. Because some patients will be using a new name and don't prefer to be addressed by their dead name. And so we're trained to, if we mess up, we're not going to get flustered or angry with the patient, as in perhaps some other offices where front desk staff could potentially be, a little less patient. So we always, beg their pardon, and it's a learning experience for us.
Right.
I often say to my patients, if I use any words or verbiage or the incorrect pronoun, please correct me. I'm not doing it on purpose, and I'm going to strive my hardest to make sure that moving forward I use the terms that you prefer.
What is the initial reaction you get from like a first timer there?
So I've had patients who've told me that they were very nervous to be there. Sometimes my MAs come back to tell me that the patient does seem a little nervous, a little apprehensive. And I go in there with a nice big smile. I mention, I'm part of the community too. Just mentioning all the services we offer there. I tell them about myself before we get into diving into all about them, just to kind of break the ice.
Right.
By the end of the visit, I've seen some of those apprehensive and nervous patients just melt away into being very comfortable and happy. I've had a few patients, and some of them in the geriatric population, who've teared up in front of me, saying that, I remember one patient in his 80s started tearing up. He was just so moved that he could finally have a gay doctor, and after so many years of just having to go see other physicians where he never felt welcome.
How does that make you feel?
It makes me very proud of the work that we're doing, and really reaffirms, the importance of our clinic and our place here in the community.
So maybe explain a little bit, is caring for folks in the LGBTQ plus community different than caring for folks outside of that community? And if so, how and why?
Yeah, so, every human being is susceptible to all different illnesses. The standard, everybody, we have patients who have high blood pressure, thyroid issues, etc. But we do know that, and certainly it was mentioned in that report that you had mentioned at the beginning of the interview from New York State, we know that we have a higher incidence of mental health issues, substance use. We see higher rates of obesity, cancers because of lack of cancer screening. So patients are a little bit more reluctant to go get cancer screening. Certainly if we have sexually minoritized women, which is kind of the umbrella term for whether it be lesbian or bisexual and transgender women, kind of falls underneath there. There's not always they haven't always sought care for, let's say something routine like a pap smear to screen for cervical cancer, or even a mammogram to screen against breast cancer. So all of those higher incidents of, those medical conditions that I mentioned earlier also add to risks for some of these other, more severe conditions that can develop over time, such as cancers and other things that we screen for. So we need to make sure that we're pushing for that and making sure that we're doing that extra screening. People in the LGBTQ plus community also, we need to ask our patients about their sexual health and their sexual practices. So the screening for a heterosexual monogamous patient who is in a monogamous relationship, married for several years, etc. Their screening is going to be very different from, say perhaps a young gay man or a young bisexual woman. So we take care to do all of the proper screenings. I can say previous clinics that I've worked at in the past, I kind of been pushing towards getting some of these other screenings. At our clinic, it's just kind of standard. I mean, if we weren't to do one of these screenings, it just happens. So that's kind of where the importance of providing specific care for the LGBTQ plus community kind of comes about.
So when people have bad experiences, they share them, sometimes a lot, right? With lots of people. Don't go here. Don't see this person. If they're getting great care at your center and they're feeling comfortable and they're really happy with it, are they spreading that as well? Do you get people coming in through word of mouth?
Yeah, I would say currently, we did a big press blitz kind of the first summer. So we got a lot of patients coming in from those different ads that we're running in some of the local papers and other publications. But I would say now word of mouth is probably one of the largest sources of where we're getting our new patients. We ask all of our new patients, in addition to the pronouns that they prefer, their preferred name, how they prefer to be identified, their gender identity, and their sexual orientation. We also ask, how did you find us? Because we want to know that. And a lot of patients are coming in by word of mouth referral, which is really great to hear.
You seem really happy with where you are and what you're doing.
Yeah, I certainly am.
Great. Thank you so much, Dr. Eric Lella. We appreciate your time. Great information, great place, great services, great opportunity for folks who may not have felt so comfortable to go someplace where they're comfortable. That's really important. We have more when we come back after this break. We're going to be learning lots more about the East Hampton Emergency Department. Stay with us. Hello and welcome back. Thanks again for joining us. Now we're going to learn a lot more about the new East Hampton Emergency Department. Joining us is Bob Chaloner, Chief Administrative Officer for Stony Brook Southampton Hospital. Thank you so much for joining us.
Oh, it's my pleasure to be here with you today.
So what can you tell us? Start from the beginning about the project and why it's so important to folks in East Hampton.
Well, the East Hampton Satellite Emergency Room is really a very important project. It's important from many perspectives. But it's a project that started almost 10 years ago. As many people in the community know, the hospital is in the process of planning and developing to build a new hospital facility at the Stony Brook Southampton College campus. That's a move that we're excited about because it will give us a nice piece of property to build a new state-of-the-art community hospital on it, something we need given the aging of our facility today. But it did create, when news first broke about it about 10 years ago, concerns with people in East Hampton. East Hampton is already fairly far removed from the hospital. Mm-hmm. It can be easily, on a good day, half an hour drive. With traffic, it can be over an hour to get to the hospital. And the fact that we might move 3 to 4 miles further west was a concern. East Hampton's also a community that isn't served by a plethora of medical staff. There's some very good doctors out there, but very, very limited medical resources currently in East Hampton. So through discussion with a number of town leaders, we developed the notion that we need to put more of a presence out in East Hampton. And the notion of an emergency room developed when New York State, in around 2016, issued something called innovation grants, grants that were intended to help improve healthcare in local communities throughout the state. And we identified a need to provide more healthcare. We noticed that in many parts of the state, there's a sense that hospitals are overutilized. East Hampton residents are typically not visiting hospital or emergency room as often as we would expect them to, and we realize that the distance and the traffic is a deterrent. That, coupled with the fact that we were seeing an increasing delays for people to get to East Hampton as the traffic's continued to grow, caused us to develop this notion of a satellite emergency room, which was a very unique concept in New York State in 2016. There were 1 or 2 of them that were in existence. Many people are familiar locally with when St. Vincent's closed in Greenwich Village. Lenox Hill opened a satellite emergency room down in Greenwich Village to serve that community. So we applied to the state for permission to do something similar in East Hampton, and the state not only agreed with the concept, but awarded us a $10 million innovation grant.
What was the initial reaction when news broke that that was approved and that there was money for it from the folks in East Hampton?
Well, the initial reaction was, I think, across the board, there was a great deal of excitement with the project. Concerns about what would a satellite emergency be. Many people, and especially in our region, aren't familiar with it.
Right.
But overwhelmingly enthusiastic that we're going to be providing a facility out there that will make it easier to access healthcare for people in East Hampton.
And so, where exactly will it be? What services will be provided for patients, and when is building scheduled to start?
Great. Well, the facility will be located off of Pantago Road and right behind Town Hall, essentially, where Town Hall is in East Hampton. People are familiar with that. Mm-hmm. Behind Town Hall, there are 2 Little League fields, about 4.5 acres of land. And we went through, the first thing we had to do with East Hampton Town was to identify a location for it. We looked at a number of different areas that the town proposed, and one of them was those Little League fields. That was identified as preferable for a number of reasons. One, it's closer to the heaviest year-round population in East Hampton, the Springs population. It's also a little closer to East Hampton, and there's another medical facility already there, the East Hampton Healthcare Foundation, which has medical offices. So the notion of developing some adjacency and creating a bit of a medical campus was very desirable to us. The facility went through a long planning process. The town put us through our paces in terms of evaluating the site, but ultimately that was the site that was approved, and we're excited that that's going to be the location at this point.
And when will it be up and running, or when does construction start?
Sure. Well, we're just at a point. We've received all of the necessary approvals. Anything in healthcare is a very
right.
long bureaucratic process.
That's a long list.
It's a very long list of approvals, and especially out here, as we're trying to make sure that it fits within the town's needs, we went through a lot of planning considerations, regulatory approval. And we had to fundraise for it too, and we've completed all of those steps.
You mentioned fundraising, but you also mentioned that there was money granted from the state. So who's doing the fundraising? How much money came from that, and is that enough to build the facility?
Right. Well, we originally started with an estimated budget of about $30 million. Over time, we escalated that up to $35 million.
Oh.
And the state grant is $10 million. They had a $10 million matching requirement.
Oh, okay.
But we set for ourselves a $25 million fundraising target. We've actually surpassed that. We're
great.
Up to about $29 million in fundraising. So we've raised a total of, with the state grant, about $39 million.
Where is that fundraising money coming from? Local groups or?
Two different groups are leading the charge on that. One is our hospital foundation, the Southampton Hospital Foundation. And the other is the East Hampton Healthcare Foundation, which is a private charity in East Hampton whose sole mission is to build or bring healthcare to East Hampton. And we've worked very collaboratively with them for almost 20 years. And we've each used our circles of influence to try and identify donors who would be supportive of this project.
And when realistically do you think it will be open?
It's about a 12 to 18 month time frame. So ideally I'd like it done by summer of 2023. I don't think we'll meet that deadline, but sometime by middle to end of 2023 is when we'd like to have the project completed and ready to open. And
tell me about the facility. What kinds of services will be offered there? What can people, anticipate?
Sure. Well, first of all, it's important that people understand this is a satellite emergency room. So many people are familiar with urgent care centers or walk-in centers. This is different because it's actually equipped to handle true emergencies. So an ambulance can bring a patient. You call 911, an ambulance can bring a patient to this facility. It will be an ambulance receiving facility. And it will be equipped it'll be, the most important part of it is the people in it. So it'll have board certified emergency room doctors and nurses and technicians, people that are trained to deal with emergency medicine and true emergencies. It will have about 12 different treatment rooms of different types. All of them will be equipped with cardiac monitoring. We'll have a full array of imaging, X-ray type equipment, CAT scan, MRI, all of the imaging equipment that's required for an emergency room. Laboratory, pharmacy, all of the sort of backup support facilities of an emergency room. It will be able to handle a significant number of the emergencies that come out of East Hampton today, but there'll be certain things that obviously it won't do. We have a cardiac catheterization lab at the hospital today. It will not do cardiac procedures. It will not do surgeries at that facility. Those would have to be transported.
This is for true emergencies that need immediate care.
Right. True emergencies can be treated there. And even somebody who's having a stroke or having a heart attack or potential heart attack could be brought there and stabilized for transport to the main hospital or to another hospital. And in healthcare, it's all about time, getting people treatment as quickly as possible, and this will significantly shorten the time frames for people from East Hampton.
Talk a little bit about, East Hampton, you said those folks were year-round residents, weren't really utilizing the hospital for a number of different reasons. But East Hampton gets especially crowded during the warmer weather and summer months. How will this ultimately help with that also when you've got people, from out of the area, not familiar, perhaps emergencies that they didn't plan on, which is the nature of the word emergency, right?
Question. I mean, you're absolutely right. Both Southampton, East Hampton, we are flooded with visitors, and people often don't have people who live here year round may have a doctor that they can call up. Visitors don't have any connection to the local medical community and are much more likely to want to go to an emergency room, and this will be another facility in East Hampton that people can turn to for those emergencies. And most emergencies are the falling down, breaking a bike, falling off a bike. We have very very active lifestyle out here.
Yeah.
And with that comes a certain number of accidents and things. So having this facility will help the community too. We see it as a benefit at the main hospital because our emergency room gets extremely busy in the summer, and this will offload some of the volume that we see during the summer, and hopefully make the experience in the main emergency room a little less crowded as well.
You made a really interesting point. It's a different kind of lifestyle out here than perhaps some city visitors are used to. So maybe folks who have not been on a bike in a really long time, or have not, taken a stroll down with lots of people, or have not been in the water, right? Water, boats, things like that. Lots of things people haven't done regularly.
We see that a lot. We see the weekend warrior that really is pushing themselves a little bit too fast and hard. We see bike accidents are a big challenge, especially with the crowded roads. People deciding to body surf and never having done that before, and all sorts of accidents associated, all ages. So we want people out there, but we also want to make sure if something happens, we've got the ability to care for them quickly.
Right. Okay. So if people want to support the emergency department, is fundraising still going on?
I'm sure we keep hearing about all the price escalation for materials and building and things, so I'm sure we're going to continue to need to raise money. And there's two ways people can support. They can support the Southampton Hospital Association. Just get on the hospital's website, Google Stony Brook Southampton Hospital, and they can find our foundation. They can also Google the East Hampton Healthcare Foundation and support through the East Hampton Healthcare Foundation. As I said, we work very collaboratively. Every dollar that's pledged toward this project goes to that project from both foundations.
Okay, I actually have phone numbers for those two organizations, so let me give people contact information. You can call the Southampton Hospital Foundation at 631-283-4404, or the East Hampton Healthcare Foundation at 631-324-8943. Bob Chaloner, thank you so much for joining us. Great information, a great project once it gets up and running.
Thank you very much to Sun TV and all that you're doing in the community as well. It's been a pleasure being with you.
Great. We appreciate your time. Thank you for joining us. That's all the time we have, but we'll see you next time on Your Health Matters.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine Healthcare System, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.